All right. Yes, yes, indeed. So welcome to everyone. It's so great to see you for our fourth Coffee with Gina and Friends this year. And our topic today is skin cancer, facts versus fiction. I think that there's a lot of fiction out there. So Dr. Healy is going to brilliantly update us on what's true and what's not. So again, thanks for being with us. It's hard to imagine that it's already June. We're just sliding right into June. So I think most of you can probably hear me and see me because we just kind of went through the greetings. So raise your hand or your paddle. How about that? Raise your paddle that you received with your little gift bag to let us know that you can hear and see us. Thumbs up. All right, there we go. Excellent. Now, I would caution you that paddle is only for this event today. You are not to use it to smack your spouse or kick the dog or any of that stuff. It's just for today. Actually, they're kind of fun. I will confess I did smack my spouse with it. Of course, he's very tall, so I had to reach. Okay, like our other coffees, you'll be muted unless you have questions. So we do like to watch the screen. And if you have questions for Dr. Healy as we're going through, you can just signal us and we will unmute so you can ask your question. So this is an ideal time of year to come together to discuss the facts about skin cancer and also to dispel the myths. You know, we're sliding into the hot months here in Phoenix and where else you may be. So it's important to have this topic presented. I don't know if you knew this, but I was happy to learn also that May is Skin Cancer Awareness Month. So this topic is especially timely. It's our goal at all coffees with Gina to keep you up to date on the most current health and wellness developments. All right. So today we have the presenter to do just that. Dr. Mark Healy is a surgical oncologist from Banner MD Anderson Cancer Center on the Boswell and Del Webb campuses right here in our very own community. He specializes in many types of cancer, including melanoma, a serious type of skin cancer. And you know what? I saw an alarming statistic this morning. I'm not sure if it's accurate. I'm sure that Dr. Healy can let us know. But I saw a stat that said this year that 1 in 28 males and 1 in 41 females will be affected by melanoma. So that's kind of a scary statistic, and it's probably pretty close to being accurate. Dr. Healy attended medical school at the University of Chicago, completed his internship and residency at the University of Michigan. He also completed postgraduate training that includes not one, but two fellowships, a complex general surgical oncology fellowship at the University of Texas, MD Anderson Cancer Center, and a health services research fellowship at the University of Michigan. So he bounced back and forth between those two spots. I would venture to say he's kind of a brainiac when it comes to cancer. Also at the University of Michigan, he earned a Master of Science in Health and Healthcare Research. It's clear that Dr. Healy is among the best in his field, which is why he is a Banner MD Anderson, and why it is such a treat for us to have him with us today. Now, we wanted to make our coffee this time a little more interactive, so Joyce and Lindsay delivered goodie bags to you, and that was out of the generosity of Dr. Healy's office. So be sure to go through there and use all of those products. And then also your paddles that you received. And so again, throughout the presentation, Dr. Healy will be dropping some comments to you about a myth or a fact, and he will invite you to put up your paddles, whether the green with the thumb up means yes, that's true. The red with the thumb down means that's probably a myth. So it's going to be a lot of fun to do this today. So we're going to keep track of who's getting things right, and keep track yourself of how many you're getting right, because we have a bit of a contest on this and prizes at the very end. So we look forward to answering your many questions as well. So please be thinking about them, and we'll pause periodically to address them. And now it gives me great pleasure and quite an honor to introduce Dr. Healy.
Well, thank you very much, Gina. Let me just try and get my screen set up here for 1 second. Get this talk going. Okay, can you see it, the screen, Gina, that says skin cancers, fact versus fiction?
Yes, we can.
Okay, all right,
We're
perfect.
set. All right.
Well, thank you so much again to Gina and everyone at Sun Health. I really appreciate the opportunity to be here. This is going to be hopefully an interactive and somewhat relaxed talk, but I want to go over some important information and hopefully we can have a back and forth. Like Gina said, I do work at Del Webb and Boswell. I have a melanoma clinic at Del Webb, and I'd be happy to talk to people more about any questions about that as well. So before we start, I just wanted to mention I do not have any financial conflicts of interest regarding this talk, and we don't endorse any individual products or businesses. The talk in general is just meant for educational purposes. We are here for Sun Health, but I do want to mention here at the Banner MD Anderson Cancer Center, we have our own Melanoma Center of Excellence, the T.W. Lewis Melanoma Center of Excellence, and really it's a group of all of us helping to care for patients with melanoma and work on prevention, treatment, clinical trials. We collect a database and work on survivorship as well. All right. So skin cancer is the most common type of cancer in the US. Many people don't know that. There are 5.4 million new cases of skin cancer. Non-melanoma skin cancers are the most common, basal cell and squamous cell carcinoma in the US per year. And it's likely an underreported number. There's a 1 in 5 lifetime risk in the US of getting skin cancer. And according to the American Cancer Society, in 20 years, it's going to become a 1 in 3 lifetime risk. And we've already seen that in other parts of the world. Australia and New Zealand, people there have a 1 in 3 lifetime risk already. Another way to look at it is one person dies from melanoma every 54 minutes, and there's a 2% increase in melanoma incidence every year, kind of going to what Gina was talking about there. So we'll just dive into the basics to give everyone sort of the same baseline understanding of what we're talking about here. So the skin is the body's largest organ. It protects against heat, sunlight, injury, and infection. It also helps to control body temperature. It stores water, fat, vitamin D. And the skin has several layers, but the two main layers are the epidermis, which is the upper or outer layer, and then the dermis, which is the lower or inner layer. And when we talk about skin cancers, especially the most common kinds, it begins in the epidermis, that outer layer. There's 3 kinds of cells, which you can see highlighted here. So you have squamous cells, basal cells, which are down here, and then melanocytes. So squamous cells are thin, flat cells that form the top layer of the epidermis. Basal cells are round cells that sit under the squamous cells, and melanocytes are the cells that make melanin and are found to basically give pigment that gives the skin its natural color, and they're in the lower part of the epidermis, as you can see down here. What is cancer? So cancer is caused by an uncontrolled division of abnormal cells in a part of the body. It's a malignant growth or tumor resulting from a division of these abnormal cells. It's a very general term that we use for lots of different things, but cancerous cells divide repeatedly and out of control, and they're not needed, and so they crowd out other normal cells that do function normally, and this is where we get into problems. What is skin cancer? So skin cancer refers to numerous diseases in which abnormal cells grow uncontrollably in your skin. If left untreated, skin cancer can spread throughout your body, tissues, and organs. And I wanted to just go through with this slide here some different types of skin cancers and even precancers. So to start with, here we have actinic keratosis. This is very common. We see these a lot on patients. So this is a precancerous lesion. It appears sort of rough, and there's a scaly patch on your skin that develops from years of exposure to the sun. Only about 5% develop into skin cancer, and the skin cancers that come from this are non-melanoma skin cancers, non-melanoma. There's atypical moles, as you can see here. So they're typically benign, but they're sort of a bit of a red flag if you see one of these, because individuals with atypical moles are at increased risk of melanoma. And some people, and I do see this, will have atypical moles that look the same for many, many years, and then they come to see us after they suddenly change, and they can turn into melanomas as well. Basal cell carcinomas, which you can see here, they develop from skin exposed to the sun. They're the most common type of skin cancer. And thankfully, being the most common, they're also the easiest to treat. Jumping down here, so squamous cell carcinomas, those are the second most common type of skin cancer and also are fairly treatable if caught early. The deadliest form of skin cancer is melanoma, which you can see here, and we'll talk quite a bit about that. That's my area that I tend to work with in terms of patients. And then I also treat patients with Merkel cell carcinoma, which you can see down here. This is a rare type of neuroendocrine skin cancer, and it can look like a flesh-colored or bluish red nodule. So woven throughout the presentation today are some statements about skin cancer and skin protection. And we want to see what you think, and then we'll kind of talk about the topic and give some more information. So we've got some initial things here to start with. So just raise your paddles with a thumbs up for true or a thumbs down for false. So number one, skin cancer is always hereditary. Who thinks that's true or false? Okay. All right, I think everyone's had a chance to respond, and we'll talk about this. And then skin cancer generally hurts when you get it to the touch. Raise your hand if you think that's true or false. Okay, good. So we'll talk a little bit more, but I think everybody is pretty much on the same page. So many skin cancers, almost I would say the vast majority are not related to hereditary things alone, although there are certain risk factors that increase it. And most of the time when people come in, they don't have pain from their skin cancer. Sometimes they'll notice an itching or tingling in a mole that was not causing them any concern before, but more often than not, it's a very painless thing, and it just ends up being something that people are, if someone notices, a loved one, or you notice that it's changed, and then get it checked out. But let's talk about the things aside from hereditary things that actually cause skin cancer. So overexposure to the sun causes 90% of skin cancers. One blistering sunburn before the age of 18 increases the risk of melanoma by 50%. And this is important with those with children or grandchildren who may not necessarily be making these decisions for themselves. It has a huge impact down the road on your chances of getting melanoma. 5 blistering sunburns before the age of 18 increases the risk of melanoma by 80%. And then talking about who's at risk, so it's really everyone, and we'll talk more about that, but the lifetime risk for melanoma for Caucasians is 1 out of 38 people. For Hispanic Americans, it's 1 out of 172 people, and for African Americans, it's 1 out of 1,000. But people of all skin colors can develop skin cancer, and I've seen that. And it's one of the easiest cancers to detect, and most types are highly curable if you can catch it early enough. So here's some important facts about UVA and UVB radiation, and we can talk more about that. UVA radiation makes up about 95% of what we get from the sun, and UVB radiation makes up about 5%. However, the UVB radiation is the most potent in terms of the chances of causing skin cancer, although both are potentially carcinogenic. So you can get a sunburn on a cloudy day. It's something that a lot of people may not think about if it's overcast, but UV rays can damage your skin even with that, and all year long too. It's not really a seasonal thing. UV rays can reflect off of surfaces like clouds, water, snow when you're skiing, sand, and even cement. Not all sunscreens protect against both UVA and UVB rays. The traditional way that people had thought of it was UVA rays kind of reflect skin aging and UVB rays skin cancers, but both actually do contribute to risk for skin cancers. And then lastly, you have to watch your eyes as well. So people can get ocular melanomas, and so it's important to make sure that you protect your eyes. They do make sun protectant contact lenses, and then there are plenty of different types of sunglasses that can protect against UVA and UVB rays. And you can also protect against the risk of cataracts later in life as well. So who needs sun protection? Everyone. it's important because the sun's ultraviolet rays can cause sunburn and other skin damage that can lead to skin cancers. So here's some more fact versus fictions. What do you think? Okay, so number one, the morning sun emits fewer rays than the afternoon sun. True or fact or fiction? Okay, I think everybody's had a chance to respond. Okay, winter sun is safer than summer sun. Okay, and then the sun is safer in a more northern state or country than a more southerly one with warmer or sunnier days. Okay. All right, these are some tricky ones here. So I'm going to go ahead and talk about them a little bit, and then we'll also go into more detail of the science behind it. But the first one, the morning sun emits fewer UV rays than the afternoon sun. It's kind of a tricky question. I can't say that one or the other is incorrect. The truth is the UV rays being emitted by the sun is the same. However, it is protective to go out outside in the morning. Before 10 a.m. is usually what we would recommend in terms of avoiding the sun at its maximum exposure level. That being said, that it's not necessarily reflective of the sun actually emitting fewer UV rays. So a little of a trick, but that's a good one. And then winter sun safer than summer sun. I would say that's not true, and I think most people were on board with that as well. And a large part of that is, yes, the winter sun is at a different angle than the summer sun, but you're still getting a lot of reflection. You're still getting a lot of sun, especially in a place like this, which then leads to the last question, which is the sun being safer in a more northern state or country than a more southerly one. That's also a very complex question. And this has been studied in different places. In Norway, which is very northern, there is actually very high rates of skin cancer. And it's mostly because people do participate in a lot of sun-seeking activities. So you can imagine if you were in Minnesota or Illinois or Michigan, and you get those few nice months of the summertime, everybody's outside, everybody's on the lake, everybody's in a boat, and there's a